our cost of the actual hardware itself from our company's side is probably cut in half, which is amazing. So that's an instant increase in margins.
Hello, you're watching Proactive. I'm joined by Shane Bishop, the CEO of Custom Health. Shane, very good to speak with you. You've worked with Spencer Health Solutions technology for some time. Why was now the right time to bring it fully in-house?
Yeah, I mean, we've spent the last few years integrating the product into our core capabilities and really started to leverage the data that was coming from the device to provide our clinical services. With that kind of test, that model being now ingrained into our DNA, it made sense for risk to actually make the acquisition, bring them in-house. We certainly didn't want someone else to come along and scoop them up, so to say. So it's definitely a huge opportunity. We're very excited to have them on board. Amazing team, and really have already become part of our DNA. So now it's just about executing with some scale.
How will owning the technology improve medication management for patients, healthcare providers, and also your pharmacy partners?
Yeah, I think, owning it allows us to now control, dictate the direction of the technology itself. We're picking them up at an opportune time. They've already created their Gen 2 device, which from our perspective, now that we're, coming along and working alongside the team directly, looking at the AI capabilities, we wanted the device to have, a little bit better speakers and for AI interaction. We get an amazing amount of data off the device by individuals answering questions on the screen. This patient report outcome data is very, very valuable to our clinical team. Going to voice activation and having some authority and say over that is paramount to, I think, where the industry is going. So collecting more data from patients in real time, feeding an AI engine that really does streamline the processes internally and generates information for our clinical team to action, and that's kind of the goal. So as the world kind of changes and moves into this AI area with our clinical insights, we want a control of the device and make sure that it was very streamlined into our direction.
The deal's also expected to improve margins and give you control of the product roadmap. How important is that as you scale the business?
I think it's super important. Margins can be thin in healthcare, and I think by owning the device, number one, we control the cost of the device. High level, by owning it, our cost of the actual hardware itself, from our company's side, is probably cut in half, which is amazing. So that's an instant increase in margins. There's a lot of duplication out there with what we're doing and what their organization was doing when it comes to supporting patients. We're paying them for support, cell coverage, those sort of things. When you consolidate the companies, a lot of those extra costs go away, and we see an incremental margin increase. So I think on a per patient level, which is what this is all about, how much cash can you generate from an individual patient by providing a very strong clinical service and driving these outcomes. Every dollar accounts per patient, and so this really allows us to change the dynamics and really focus on that margin increase at a per patient level.
Looking ahead, Shane, how does this acquisition strengthen Custom Health's growth strategy, and what should investors watch out for over the next year?
Well, I think the nice thing is we now control our costs. We know exactly what the base cost is going to be. So now we can be more aggressive in the market and go after more providers and health plans because we have a very stable baseline cost that we can jump off of. And that's super exciting. So there's been a little hesitation in the past. We've done the pilots. We signed some very large, agreements, contracts. Now we can be more aggressive in the market, and that's going to be very exciting because that we know exactly what that cost point is.
Shane, I hope you'll continue to keep us updated with your progress. Thank you very much for your time today.
Thank you so much. Really appreciate that.
Shane Bishop, the CEO of Custom Health.